Welcome to Live from HCIC 2023, a podcast series bringing you front row insights from the industry's brightest minds. In this 12-part series, we delve into the heart of the trends impacting health systems with leading experts, senior executives, and thought leaders, as recorded live at the Healthcare Internet Conference in November of 2023. This series is brought to you by Greystone, Bowstring Media, and Touchpoint Media. Listen in as we hear from our industry leaders on the latest innovative strategies and efforts that are shaping our space. All right, I'm here with Kelly Faley here live at HCIC. Yes. A lot of noise in the background because we're right here in the expo hall. There's a lot of things going on, but Kelly, I'm so glad that you could join us here today.
Thanks, Chris. It's a pleasure to be here.
Well, it's always fun to talk to you. You know, you and I have presented before, and several times, and we've been conversing about digital and everything like that. And you're someone that I've looked up to for all this
that's nice.
Most of my career. So, you know. But before we get started into our topic today, there's some people maybe watching or listening in that don't know you. So why don't you share a little bit about yourself, your background, and how you got to where you are now?
Okay, so I'm Kelly Faley. I'm Vice President of Digital Experience at Sharp Healthcare, which is in San Diego. I've been there for 32 years.
Wow.
It's not my only job after college, but almost my only job after college. And I started actually as a communications specialist in one of the hospitals at Sharp. And then I moved around the marketing function over the years. And then in 98, 99, I started doing digital and just kept going. And I never stopped. When we started with digital, it was kind of off on the side, this little side project.
Yeah.
And there was a group of four of us that would go into this little tiny conference room that nobody knew about once a week. And we did it on the QT because we weren't really sanctioned to work on it. And then when it was ready, we brought it out and everybody liked it. And so we were able to keep going.
And then suddenly it became a formal part of your job.
Yeah, at some point, at one point, at that point, I was the director of marketing. I was supporting women's services. And then we realized we needed somebody who was really going to focus on digital, and I wanted to do it, and they made me take a step back. And so I became a manager just so that I could work on digital, but I really believed in it, and I liked it, and I was kind of like, well, crap, I guess I'd rather be a manager of something I like than a director of something that's kind of not as much fun. So I did it, and very quickly then got my title back probably within a year and have stayed at it. So it is always fun. There's always something changing.
And digital back then was a lot of...
Oh my God, yeah.
And it's evolved over the years. And I've even seen in the last, 10 years that digital has even evolved extensively further. Tell me a little bit about your perspective on this.
Oh my gosh. I think back about it, and I remember after we'd been doing digital for a couple of years, one of the screening criteria I had for new jobs on resumes is if it said that they were proficient in front page, I said, okay, that was not good enough for it anymore. But yeah, so that was that was a long time ago. What I think is that in the early days, the digital was so much just about almost brochureware on them. And it was really about the content we put online and the design, obviously, but we didn't know anything about usability, and we didn't really know much about analytics. And we had a developer who helped us, but it was very, very marketing focused. And it stayed that way for a long time. The most important piece of the website still pretty much is, but has always been about find a doctor, but all the stuff that goes around it had always been very content-driven, very marketing-driven. I think what's really changed the most is that now when we look at the website, it's actually a key tool to operations.
Right.
And the operation, when it goes down, it's not that we're going to lose leads and marketing conversions. The panic that comes if the website goes down is how are patients going to not call us? What are they going to do so they don't call us? Because we don't have contact centers staffed for that volume of calls.
Right. Or make an appointment online.
Make an appointment.
Or access a medical record.
Send a message to my doctor.
Yeah.
Get directions. Get a phone number. Any of those basic things becomes very operationally focused. And we got there probably, 10 years ago, I'm guessing, because we did this really deep dive into what do we want to do next with the website. And so we dove into the analytics, and we were shocked because for years we're looking at this as like what marketing area, and are they looking at the health content or about our services and about our locations, and what are they looking at? They're looking at billing, directions, phone numbers, how to schedule an appointment. They couldn't schedule an appointment at that point, but it was all very task-oriented. And that's where we said, oh my God, we really need to shift focus. And, by that time, pretty much every other industry had started to shift focus too, trying to become much more operational.
Yeah, well, it's like something I say is that people don't go to a hospital website for fun. They're there to do something, right? It's not like, I go to other websites for fun.
Yes.
But when I go to a hospital website, I'm there to actually transact.
Yes, this is not entertainment.
This is right. I mean, and it's critical. It's their health in often cases, right? I need to make my way to my doctor. So now by default, we are like spending a lot of time in our space, in the traditional digital marketing space. We're spending a lot of time in doing things that are more operational in nature.
Very much.
And so now we're getting very, very close to and partnering with IT.
We are. And operations.
Yeah. So that's I think what we could talk about here and now is that, because that partnership is different. It's something that, just like you, 15 years ago, I wasn't having that partnership.
No.
But now I am. And these people are not the same cut of the same cloth as us.
No.
Is that fair?
That is true. That is true.
So tell me a little bit about how you see this.
So our structure at Sharp is we have our entire digital team, and it's split in half. So half of them report up to me as the VP of Digital Experience, and we are responsible for business strategy, content, UX, analytics, but really around with strategy and UX is around the workflows. What does the patient want? And we do all the prioritization. So we have product managers that we've built a whole product management discipline. And that role is really to understand what the patient, the customer wants and needs, and then putting it in place in a way that they'll use it, and prioritizing. Because we had, like many systems, had gotten into this bad habit of somebody says that this product here that they found or saw at a conference was going to solve all the problems that they've ever had, and so we're going to install it. And it didn't solve the problems and probably created others. And so this process has really done wonders for us to make sure that we have fully vetted what the problem is and what we're trying to solve, and then is this product going to solve it? So that's all the responsibility on the business side. And I sit in marketing, partly because we always came up in marketing, and it's like, where else are we going to go?
It's a nice natural fit.
It's a natural fit. Then there's the, on the IT side, we have all the development. And so there's business analysts and developers and QA and, server administration. All of that gets managed in IT. And over the years, there's been friction as we've, worked through all of this. But the beauty of it is, and where we are now is really a well-established, well-oiled process. The developers, they don't really want to even think about what's most important next. They're happy for us to make those decisions. They love that we'll go talk to the operations teams and say yes or no to them and explain why. They love that we'll come to them and say, this is what we need to have built. And they can sit their heads down and build and not had their time taken up doing other things. And for us, we started down that path and that division because, frankly, developers are expensive and they are hard to find good ones that you're going to keep. And we didn't want to spend money for a developer talking to stakeholders instead of developing.
Right.
We couldn't go fast enough. So we needed them to stay focused on that. And it's worked out really well. But I think the reasons it works well, and besides what I said, is that there's really strong relationship. We've really clearly defined who's going to do what. We're really clearly developed strong relationships with my counterpart, not in IT, and we are in so the close touch with each other and review everything so thoroughly that either one of us have told our teams that, if you can't find me, go ask John. John says, if you can't find me, go ask Kelly, because we will make the decisions, and we can most of the time speak on each other's behalf and really feel confident that we're not going to screw something up. Yeah. And I think that that's because we've spent a lot of time building relationships, building that trust.
Yeah.
And that trust comes from defining what you're going to do and doing it.
And doing it.
And being successful and having each other's back so that nobody feels like they're being thrown under a bus.
Yeah, so it's not us versus them.
Right. It's just a we. It's always we.
It's always we.
It's always we.
Right. And I think that's great, because what you're describing, if you think about it, like, in other industries, digital teams are like integrated, and they're one. And you do have the front end strategists, UX people, et cetera, the people that develop the strategy, and then you have the doers on the back end, and there's this cohesion between them.
Yeah.
In health systems, we naturally kind of grew up as these siloed groups.
Exactly.
And I think that's in part because the CIO is like responsible for all the core infrastructure stuff too. Right? They're also responsible not only for the websites, they're responsible for making sure they have an EMR that works. They're responsible for making sure they have an email system that works to communicate with everybody, and security and cyber attacks and all these other things. But if you have this partnership, which is really something that is, it's net new in health systems. I would say that not many health systems have embraced that. What do you think?
I think that there's a lot of different models out there, but I still hear so many people on the marketing or business side who are constantly frustrated or feeling like they're being blocked by IT, and that they don't have those relationships there. And I think that I think part of it is also to get there and to get started there is that the CIO and their leadership teams need to feel, they need to understand, but even though they are IT people, they say they're not feeling, they need to feel that you're going to support them. You're not going to put them in a position where they have to come back and say no, or that they look bad. And, so really, what are their goals? They're getting asked to do all of these things. They don't know which one's most important. So if you're coming in and say, look, we've got this process that we'd like to work through with you so that we can identify who's doing what, so that we can collectively manage all of these requests that are legitimate, but it's really hard to figure out which one comes first and which ones are most important and will have the most impact.
And I've worked at some organizations, Kelly, where I worked with the IT. I came in, these are separate groups.
Yeah.
I'm responsible for the websites. They're responsible for everything else.
Yeah.
And I say, well, what's our process if a website goes down? And they say, well, what you do as the web team is you call a call center. And I said, no, that's not going to work here.
Yeah.
Because we're owning the business side of making sure the website's available, right? You can't put us in the queue with everybody else.
Yeah.
Right? We have to have a process that kind of aligns to it. At first, they felt a little threatened, right? At first, they're like, wait, what are we doing here? Part of me thinks it's because of the mentality. And let me explain myself here. We in digital marketing and the people that traditionally the UX people, the people that look at the customer first, et cetera, we're risk takers, right? We want to change things to make it better.
Yeah.
Whereas the people that are in the call center, the people that are the operations, the security people are risk averse.
Definitely.
Right?
Definitely.
So share what your thoughts are on that.
So, I might be lucky right now because our CIO is actually our CIIO. So he's Chief Information and Innovation Officer. So there is a large appetite for innovation. Some of that, though, I think you don't have to have an innovation officer over IT to be able to address that. They are some of them that are very risk averse. But I think that a lot of those are going to be more in the network side, the security side. In my experience, working more with the applications teams who are being asked for features and support, they tend to be a little bit more interested in doing things differently. The other thing that I think can help is relationships with your operations stakeholders. Because when we had operations saying, if the website goes down, we're flooded with calls and we can't take call volume.
Right.
It became a higher priority on the recovery plan.
Yeah.
And now Sharp.com is like number in the second tier, not the very first tier, which I think is appropriate. You know, let's get life support back on first.
Yes.
And ORs can come back first.
Yeah.
But we're like in that second tier because it is such a operational burden to not have the website available. It's operationally a challenge for us to communicate to our staff and the public about whether or not to come to the hospital if the website's down.
Right.
And we've had those situations. When you think about disasters that different places have, we've had fires. In San Diego, fires is the big threat. And when the fires come and power is lost or whatever, that's one of the key ways we tell staff whether or not they need to come in, or that's patients, whether or not their loved ones are safe. Mm-hmm. And we just can't nobody can handle that amount of call volume.
Right.
Yeah.
Right. I think that's a great example, right? Because we've all been faced with different natural disasters, maybe, or, hurricanes, snowstorms, whatever it may be, right?
Yeah.
I remember at one organization I came to, again, not that good tight alignment between IT and the marketing team. And whenever we had a blizzard, they would take over the homepage banner.
Yeah.
And say, this hospital is out, blah, blah, blah. And it was more focused on the employees.
Yes.
And I said, that's appropriate. But we should also kind of frame this in the mindset of we have other users of our website.
Yeah.
Because you also want to let your patients know, right, if there are complications. And by the way, you don't want to be, the house is on fire.
Right.
Figuratively, right? You want to be able to kind of communicate this in a way and understand that. So I think this partnership between IT and digital marketing, in fact, I don't like the fact that they're separated at times.
Yeah.
I like this concept of building alignment, but tell us how you were, that it didn't happen overnight.
Oh God, no.
So share some, as people are thinking about how do we do this, what would you give them? What advice?
In the old days, in fact, I remember being at HCIC long time ago and doing a presentation with my counterpart at that time. And the advice then was, I'm embarrassed about it. It was like, well, they like brownies. Take them brownies.
To bring them brownies. That doesn't hurt.
No, gifts, show appreciation.
Yeah.
And it's much more than that, but that all still counts.
Yeah.
They need to, IT and the developers at our place, they don't get a lot of the spotlight.
Right.
When people talk about the website, they call me, they don't call IT. When they want changes made, they call me, they don't call IT. On the flip side, when there are complaints, they call me and not IT.
Right.
But they're working just as hard as my team. And so some of what I do is I can be, I'm sure some people think a little obnoxious about it, but when people say, oh, Kelly, you did such and such, well, really, it was really an IT team who did that. There's a lot of that, making sure that these other teams feel that they're being recognized and appreciated for their work.
Right.
So that's part of it, I think. But I think a lot of it really is saying we can help work together to make this vision come true. We can help you by being the face with the internal customer so that you can focus on your
coding,
whatever.
Or whatever it is.
Right. The other things that we have said, and this is part of the roles and responsibilities, where we said, okay, we're design, we're marketing, we're the brand representatives. We need to make sure the website reflects the brand. So we're going to do the UX and the UI. And because it's a clear responsibility, it tends to be fine. I've had times when we've had a bottleneck and IT says, well, we want to hire a UX person. And we're like, well, we wouldn't hire a developer. So, if you've got the money and you need it, we'll hire and supervise. But but that's part of what the expectations are, and trying to just map those out. And then part of it, honestly, there have been times with different leaders where I have just had sat down and we just have a really respectful but direct conversation. And we say, I am making the commitment that I am going to support you. And I want you to make that commitment back to me. And we make an agreement that this is how we're going to behave, and this is how we're going to set the example for our team so that we can be as productive as possible.
Right.
And then we do things like, team building, group team building, and, and a happy hour and Brad.
And Brad.
Yeah.
And lots of racy charts.
Yeah. Oh, God, yes.
Kelly, this has been a great conversation. Yeah. Again, you and I think a lot alike, and I think that this really reflects sort of a model that works well. And then for those of us who are in this space, we need to hear more about these great positive examples. I really appreciate you spending some time today and chatting with me.
My pleasure. I'm glad we could do it.
Thank you for watching live from HCIC 2023. We hope these insights have sparked new ideas and conversations. A special thanks to the industry experts featured on our show, and to Greystone, Bowstring Media, and Touchpoint Media for making these discussions available. For more episodes and exclusive content, please visit Greystone.Net, Touchpoint.Health, or subscribe through your favorite podcast listening platform. If you want to be part of more conversations like this one, please make sure to attend the Healthcare Internet Conference in Austin, Texas. You can find more details at hcic.net.